My name's Lauren Benson and I'm an occupational therapy major.
My name is Peyton Barford and I'm a nursing major.
My name is Carly Cole and I'm a nursing major.
My name is Marion McCarty and I'm a social work major.
And we were assigned the profession of mental health for the XIPE project. So mental health is a very broad field and there's many different professions in the mental health field. But for this project, we decided to primarily focus on the three professions of counseling, psychology, and psychiatry. So before any people in these three fields can practice, they must first have received an education, and their level of education varies on the specific profession that they're in. So in order to become a counselor, they must have received a master's degree in either mental health counseling or marriage and family therapy. In order to become a practicing psychologist, they must have received either a master's or a doctorate degree in psychology. And then in order to become a psychiatrist, they must have received a doctorate degree in psychology as well as attended medical school. And then once they become a practicing counselor, psychologist, or psychiatrist, there's many roles and responsibilities they must fill. So first of all, psychiatrists only prescribe and monitor medications. And then in addition to doing prescribing and monitoring medications, people in the mental health field must be knowledgeable about the different developmental processes, mental health problems, disorders, and needs of their clients. They must be able to assess and test their clients for various mental illnesses, and they must be able to provide various types of therapy and treatment, including behavioral therapy, talk therapy, cognitive therapy, things like that. And they also help their clients develop multiple coping strategies to deal with any problems or mental illnesses that they may have. So we interviewed a child psychiatrist who works at Riley Children's Hospital in the division of IU Health. But in addition to working at hospitals, mental health professionals can work in many other settings, including, but not limited to, private practices, schools, mental health clinics, and multiple inpatient treatment facilities.
When we were interviewing the psychiatrist, we asked her what kind of people that she sees on a daily basis, and she answered with children and adolescents, and mainly people with anxiety disorders such as panic, separation anxiety, and social disorders, and people who are also feeling fatigue, irritable, and have sleeping disorders.
Next, we're going to talk about the importance of interprofessional collaboration. So between all the different professions, collaboration is key. Social workers, doctors, nurses, occupational therapists, and therapists/psychologists are all at play here. They all want to work together to get the best possible care for their patients. Each profession brings something different to the table, and they can make referrals to one another if they can't necessarily deal with an aspect of that person's health in their profession. So there are many interactions between the professions. As far as mental health, the person that we interviewed said she interacted with occupational therapy regarding sensory issues. They interact with nurses and doctors regarding medical issues or asking for medical advice. They interact with social workers for potential counseling and therapy. And they could also work with other departments in making referrals for other things like dietary needs or a nutritionist. Some of the observations that our interviewee said was that occupational therapists are really patient and they get clients to work super hard. And then she also said that nurses are very knowledgeable. And mostly her interactions have been positive with these other professions.
Collaborating with other majors gave us big insight on each other's future careers and made us realize that we all have relatively the same goal.
So occupational therapy primarily focuses on fixing the person as a whole, and it takes a very holistic approach. It focuses not just on fixing a person's body, but on healing all aspects of them, body, mind, and spirit.
Nursing is very hands-on, and it's very much acute care. but has the exact same need to heal people and want to heal people with medical-based knowledge.
And as far as social work, we focus on the person and environment approach to assess the individual and kind of their current situation and what's surrounding them and causing the problem. And we also use the strengths-based perspective to kind of guide them through the process of fixing their issue by using their strengths to get them out of that situation.